the question of like I'm due for surgery, I'm booked in for surgery, can you still help me? I've actually had a few of those cases, okay? So it depends on which region. A lot of times it's the neck, okay? But overall, most of the bulk of the patients that I've been able to help which have been booked for surgery have been more lower back, especially disc bulges. Now, a lot of times the disc bulges is, so for example, what will usually happen is on the MRI, they'll mention that it's usually the L5-S1 disc or the L4-L5 disc, which has a bulge, and that potentially is where they're going to have surgery, okay? Especially if they talk to the surgeon, that's what they will do. They'll most likely remove some of the disc, okay? So that will then hopefully help with the nerve, but a lot of times these disc bulges actually comes from other problems below, okay? And so a lot of times the case I've been able to help with, we don't necessarily even have to adjust L4 or L5. A lot of times we adjust lower, okay? Which can be from the pelvic joint, or it can be from the sacrum. Okay, so I've been able to help a lot of cases that have been due for surgery, and a lot of times it's unnecessary. I mean, a lot of times we've been able to help, and then obviously it can take a bit of time because they're in so much pain, for example, especially if they're getting a lot of sciatica. Okay, so that can definitely take a bit of time, but over time it should start to steadily improve. And a lot of times they've been able to avoid it.